I've been learning a lot recently from watching Alex and Leila Harmozi's content, and I heard that Leila actually had a rhinoplasty and a lip lift, so I wanted to react to her video about just that.
40% of women have had something done and they don't talk about it, right? I'm gonna talk about it. I value being honest more than I care about the people that are gonna say about it after.
Yeah, definitely a lot of people don't like talking about the various procedures that they may have had, but I definitely believe in openness and honesty, and I appreciate that Leila is willing to share her story.
There's like your podcast cover in the kitchen. Isn't it because you love looking at yourself in the morning?
No, that's not even my face anymore. This is Leila after she got her brows and her nose done.
It sounds like she had maybe more than just a rhinoplasty, maybe a brow lift as well, from what you just said.
You know, a lot of people ask why. I'm like, I don't know, I wanted to. So it's like, took the hump off my nose. So he was like, it'll be really nice if we do the nose and then your eyes, you just pull it. It's almost to the side and up. And so I did that too.
Yeah, so this gets into an interesting question of, when surgeons should suggest procedures versus when they should just do as, patients request and not much more than that. And it gets a bit tricky. There are certain procedures that go hand in hand. For example, like a rhinoplasty and a chin implant. That's something that's commonly combined, or like a chin implant and a facelift for someone who has a recessed chin, because that really helps the results of the facelift or the rhinoplasty stand out, and it puts everything into better proportion. The combination of a brow lift and a rhinoplasty I think is less critical, but if someone's looking to overall rejuvenate their face and enhance it, maybe if that's something that they're also interested in, that's fine to do. But I personally always hesitate to offer additional procedures to patients unless it's something that they've already asked me about. But every surgeon has his or her own way of handling those situations.
I wanted to be public because I think a lot of women are ashamed of getting things done. They're ashamed of having filler, Botox. By the way, I've had both of those for the last 6 years.
Yeah, these are very common procedures, especially the non-surgical, and very often people just sweep them under the rug and they pretend like they never had anything done, or they don't know anything about those types of procedures, and it's usually just false, and then that leads to other people feeling ashamed of getting the procedures, but also sometimes just people being unhappy with how they look and thinking that there's nothing they can do to improve their appearance, and in so doing sometimes improving their lives.
I've done all these things in my business career and never mixed the personal with the business. It's important in a way to be open about both, just so people know who I really am.
For her, it seems like she wants to be her true self, and part of that is admitting that you've had certain procedures done. And I think that goes hand in hand with how open they're being about running their business and all the different business advice that they offer. Also saying hey, I work out a certain number of days a week. I get these procedures when I feel like I want them. That is part of that whole openness type of theme. And I think that that's really effective for not only their brand, but also just for, psychological well-being. It's easier, I think, for many people when you just come out there and you say it, and there's fewer things that people can, online kind of hold against you or speculate, because you tell them exactly what it was. And if it's truthful, then that will resonate with people. And I think overall it's appreciated.
I value what I look like. I value my appearance. I do place value there. I'm not gonna pretend like I'm not vain.
And appearance, it's not just, again, how we perceive ourselves. It's very much about how others perceive us. And we've mentioned this in prior videos, but there have been real studies, especially out of Johns Hopkins, where they've looked at how people perceive others who've had certain procedures done, like a hair transplant or facelift or rhinoplasty. And in most scenarios after those surgeries, people have thought that those individuals looked more attractive, like they looked like they were more successful.
I got plastic surgery because I care what I look like. Whether you guys think it's bad.
So let me go back to that image, and she wrote at the top, "You should see the other chick," which is pretty funny. But it looks like she's just maybe post-op day 0 or post-op day 1 after her surgeries. And I know she mentioned the brow lift, and she has an ice pack on her forehead, and that's likely because of the brow lift. And then you can see the dressing on her nose, and you can see the bruising and swelling around the eye. So that suggests, of course, a rhinoplasty. And then you can see the crusting and and the suture line of what appears to me to be a lip lift, which, I do a lot of that surgery. So it looks like a lip lift was done, and that incision is right at the base of the nose. And you can combine a rhinoplasty with a lip lift. I used to do that when I offered both those surgeries. Now that we've honed in on hair surgery and lip surgery, I don't really do that combination much anymore, but it is possible to combine the two surgeries. I've had this come up in prior videos where people have asked, well, what about like if you were to sequence, or what's the ideal order of events between a rhinoplasty and a lip lift? And in my opinion, it's best in a perfect world to do a rhinoplasty first, make sure that you're happy with the results of the rhinoplasty, that you won't be going in for additional rhinoplasties later. And then once the nose is set, then you can go back and do a lip lift procedure. The lip lift surgeries, especially that I do, they're done under local anesthesia, so you don't have to go back under general anesthesia. And the nice thing about that type of sequence of events is that the rhinoplasty will generally make the philtrum appear longer, but you don't really know in advance by how much longer. So if you wait to see the full results of your rhinoplasty and then come in for the lip lift, that usually is the best, most accurate way to do it. But of course, these surgeries can safely be combined together. I just think you can judge better how much skin to remove for a lip lift, for example, once the rhinoplasty is done.
Bad that I did this or good that I do this is divorced from the fact that all I care about is that I'm honest. That's all I promised. I'm not saying that what I do is like setting the best example for people. I'm not saying I'm Gandhi out here. I thought that it would look better.
There's always this concern that as people talk more about their plastic surgery, especially as Gen Z is now doing, that perhaps that will encourage others to just get more and more surgery, and maybe that's not the best thing for society. There's definitely that potential, and maybe the pendulum is swinging more in that direction, and that's not necessarily always a great thing, of course. But then the other extreme is equally as troubling to me, which is where no one talks about anything, and yet there are individuals who are getting these procedures done and sort of elevating their status in society, leaving pretty much everyone else behind. So that's also unfair.
I thought the recovery was pretty good. I just decided to go on camera 2 weeks later. I was like, I'm not gonna stop making content.
So after a rhinoplasty, the main restrictions are physical activities, because you don't want to risk anything hurting the nose, right? So you don't want to bump into things. You don't want to be doing a lot of like physical activity where you can get injured. And also there's of course the bleeding risk, where if you were to work out or move around too much, then you can potentially get a bad nosebleed or epistaxis, and that would be a potential problem and something you need to go back to your surgeon for and get treated. So that wouldn't be ideal. And then from a lip lift perspective, we generally recommend that patients limit all the movement of their upper lip for 2 weeks after surgery. So it's probably why she said that she waited 2 weeks to get back to filming. And plus it takes usually 2 weeks after a facial plastic surgery procedure to really see that swelling come down significantly and for the bruising to get better. So 2 weeks is about right for how long it takes to really return to work and do most things. But again, it depends what people do. If they're a mixed martial artist, they should stay out of that for a lot longer than someone who uses more of just their voice and meetings and that sort of thing. That usually is fine after 2 weeks. But yeah, you have to consider the profession of the individual. That's important too.
I think I want to be open about it because 40% of women have had some kind of cosmetic procedure.
Yeah, 40% of women. Yeah, I mean, I think that sounds about right. That 40% of women have had some form of cosmetic procedure, and that doesn't mean full-on surgery, but that could mean just some Botox or some filler. And people are starting to do those types of treatments much younger. So yeah, I think that percentage will likely rise in the United States at least. But yeah, it definitely is a very common type of occurrence, and so something that I think will be seeing people be more and more open about as time goes on.
Like the only person that I care that likes what I look like is my husband.
One question that comes up after a lip lift is when can I start kissing again? Your wound at that point has gotten stronger, but it still needs to be handled with care. But after 2 weeks, pretty much people can stop with most of the limitations that we place on them right after surgery. And also just keep in mind that surgical healing takes a long time. So there's that first 2 weeks where it's just the worst of it, right? And then things are definitely better, but it takes months to sometimes over a year for the final results of your rhinoplasty to be visible, or for the lip lift to finally fully settle, and for the redness to go away. That takes a long time, so people need to be patient with the recovery process.
I feel like on camera I get nervous, or like I'm more intense, or I'm just not as much myself when it's like direct to camera content. feels like a show more than it is like me.
You can see here, compared to some of this older footage, what seems to be older footage because I think it's like her old nose, the nostril show has changed. And that's something that we see frequently with a lip lift, where the nostril show will increase as the nasal sill gets slightly pulled down on both sides. But as you do a rhinoplasty at the same time, you oftentimes will, as you rotate the nose up, also increase the amount of nostril show. So that combination can make the nostrils look bigger from the frontal view, from the side view. I think people just need to be prepared for that as they're going through these types of surgeries. Well, good on Leila for, again, just sharing her story, being open about it, and good on her for not letting the critics spoil her fun.